Why is it that natural health physicians are seeing patients turning up at their clinics with these serious skin conditions? What has changed?
I think there are a couple of different reasons that contribute to this change in the way we're seeing patients and where patients are seeking their care. The first is that dermatologists, although I'd like to think we're very, very well trained and we're really experts in the field, we're pretty small. We're about 1% of physicians. And especially in the last decade or so, where there's been an increased awareness of skin cancer and a push for more screening, I kind of feel like we're getting overwhelmed a little bit. So one of the common complaints you'll hear from patients is it takes forever to get in to see you, or I'm waiting 6 months. All of this, I think, pushes patients away from seeking us for one of the things we're really good at, which is acutely diagnosing rashes and managing some of these chronic skin conditions. And patients have to go elsewhere. This is coupled with, as we all know, and I think we're all to some degree more or less integrated into this concept of trying to be more natural. People are looking for healthier, more holistic approaches to both health and disease. And I would say that Western conventional medicine has been a little bit slow on the uptake with this. So again, I think patients who are looking for non-pharmacologic approaches, they realize that sometimes doctors aren't that interested in talking about it. Now, I'd like to think that Dr. Shi and I are particularly tuned in. This is one of our areas of passion, integrative approaches and alternative approaches. But I know patients who say, they looked at me and I asked about natural or botanical things, and the doctor rolled their eyes. So I think that also pushes people to naturopaths and other forms of practitioners. And then the last piece is I think that even when we do have good treatments, good medications that work, I think there is the perception that the safety risk, that balance between efficacy and safety, is less favorable in some of the pharmacologic approaches and maybe more favorable from a more natural approach. And I think really, I don't think that's baloney. I think there is some truth to that. And I do encourage patients to at least explore the range for certain conditions. Obviously, if it's something acute or life-threatening, we want to be more careful about that. But there can be a role for these less intense treatments.
Okay, so why is it do we think that dermatology seems to be so challenging, not just for doctors, you kind of highlighted it in your answer there, but for practitioners as well. What is it about skin conditions that make it, kind of tricky and kind of dicey to make an accurate and correct diagnosis? Why don't you take that, Michael?
Well, I think the first thing is that uh, most conventionally trained physicians and naturopathic doctors do not have a good foundation in dermatology. It's one of those specialties in medicine that gets little recognition in the conventional, medical school curriculum. And one has to seek that out if they're interested in it to really get enough under their feet to be able to diagnose accurately and treat accurately. And as a consequence, many healthcare providers misdiagnose or are negligent in working up a patient to find out what's really going on with them with their skin conditions with with something as simple as just doing a biopsy, and that can be very helpful in establishing a diagnosis.
Okay, so we promised to highlight 5 conditions that are commonly misdiagnosed. And I think we're going to start with you, Michael, which is your number one culprit, if I can call it that, on the list. Let's talk about contact dermatitis.
There's basically 2 types of contact dermatitis: allergic contact dermatitis, and an allergy of the skin to something that has um, the skin has been exposed to. And I say it that way because it's not necessarily a direct physical contact, because you can have contact dermatitis to something that is airborne. Chemicals, for example, can cause rashes on the face, on the eyelids, and unless you're thinking about that as a possible cause, it's really sometimes difficult to figure that out and to have that on your list of possibilities. Many cases of contact dermatitis are what I would call eczematous in nature and can be easily confused with atopic dermatitis. Um, and so sometimes that causes confusion. Um, the interesting thing that has happened in this last year with the pandemic is that there's a kind of a new form of contact dermatitis that's associated with coronavirus infection, which is a reaction to wearing masks. And the dermatologists have termed this acne. It's kind of like an acneiform eruption, but it can look different than acne also. It can just be like a redness where the mask has been worn. And I'm not sure that we totally understand yet exactly what causes that, if it's like an occlusive effect or an allergic effect to the metal that's in the mask. It could be different things for different people. We know that acne often is at least aggravated by friction and pressure. Like if you're sitting like in school and you're a bored senior high school student and you're sitting like this all day long, that can make the acne where your hand is contacting your face worse. So I think, contact dermatitis is really a subspecialty of dermatology, where there's dermatologists who basically focus just on contact dermatitis, and they're really experts in the field, and they do patch testing to determine what their patient's sensitivities are.
Anyone else want to chime in on contact dermatitis?
I think that was beautifully put. Yeah, those two types, the allergic contact dermatitis, where there's an actual allergen that we can identify, and then probably much more commonly, the irritant contact dermatitis, where it's sort of nonspecific. And that's what we're seeing a lot from general cleansing of the hands a lot. And of course, the hand sanitizers that have an alcohol base that's extremely drying and irritating. And of course, these can play off each other. Once that skin barrier is damaged, then we can sensitize to other allergens in the environment. So an irritant contact dermatitis can precede allergic contact dermatitis, as can eczema. Atopic dermatitis, sort of underlying issue, can make people more likely. So all of this is a really nice explanation about why this is such a tricky area. And then that brings the question up, well, what do we do? How do we make the correct diagnosis? So of course, a good history, doing a close physical exam, really looking at the areas that are involved. Is it just under the ring? Is it just under the watch band? Are we seeing it where there's metal touching the skin, like earrings or belt buckles? Those things will help us. And then we can do things like contact dermatitis patch testing, where we actually apply a little grid of different chemicals in a little tiny chamber called a fin chamber on the back, and we let that sit for a few days. This is very different than the kind of prick testing or blood testing that conventionally is done for allergies that are IgE mediated. Then we peel those off and we actually get the skin to literally tell us what it doesn't like. It's blistered and red. We say, aha, look, this chemical is causing the trouble. And then we're able to punch that into a huge database and look at that chemical, where it exists, and all of its cross reactants, and give the patients a safe list and say, you're allergic to fragrance and cocamidopropylbutane, and you're allergic to this and that. And then we can give them a safe list. And for many patients, it's pretty exciting. They come back in a few months and say, Doc, you're right. I don't need to do anything. I don't need any more creams. I'm okay. I just avoid those things and I'm cured. And that's very different than some of the other conditions that we treat.
I hope you enjoyed that highlight from a recent program on Nutramedica. If you want to get access to our full-length shows and live interactive events, you'll need to register as a healthcare professional at Nutramedica.org. To stay up to date with our latest programs, go ahead and subscribe to this YouTube channel, and don't forget to hit that notification bell. We'll see you soon at Nutramedica.org.